Hi students, now we are going to discuss about one important short notes from water and electrolytes. Okay, so regulation of water and electrolyte balance and maintenance of plasma osmolality by kidneys. How the kidney is taking part in the regulation of water and electrolyte balance. Okay, very important 5-mark short notes. We have 4 mechanisms for this water electrolyte balance. One is hypothalamic mechanism, how the hypothalamus reflected for the thirst stimulation and thirst inhibition situations. Second one is ADH, that is secreted from posterior pituitary, that is antidiuretic hormone, otherwise called as vasopressin, right? Vasopressin. Third one is RAS, that is renin angiotensin aldosterone system, RAS. And the last one is atrial natriuretic peptide or atrial natriuretic factors. These 4 are coming under the regulation of water and electrolytes by kidneys. Okay. Here the atrial natriuretic peptide introduction is which is secreted by right atrium of the heart. Right atrium of the heart, which increases the sodium and water excretion by the kidneys. Okay. So the plasma osmolality is very important point in water electrolyte balance. You should know about the formula for the calculation of plasma osmolality as well as the normal value of plasma osmolality. Here the formula is plasma osmolality is equal to 2 sodium molecules plus 2 potassium molecules plus glucose and urea, right? You know the glucose value of fasting 70 to 100 and postprandial 100 to 140. Urea is 15 to 40 milligram per deciliter. After applying this, they have derived the normal value of plasma osmolality is 285 to 295 milliosmoles per kilogram. The unit is very important because this is different number and also different unit. 285 to 295 milliosmoles per kilogram is the normal plasma osmolality level. Okay. Hypothalamic mechanism and ADH we will discuss in the next class. Already renin angiotensin aldosterone system we have uploaded on video. Please go through and follow the 5-mark notes. Atrial natriuretic peptide, these 2 lines are enough. Okay. Now we are going to discuss about the first and second point, that is hypothalamic regulation of water and electrolyte balance. Hypothalamic regulation. And what is the role of ADH, that is antidiuretic hormone, other name is vasopressin, which is secreted by posterior pituitary, right? We have 2 situations. One is increased thirst, another one is decreased thirst. In these 2 situations, how the pituitary and hypothalamus and kidney will act and how they maintain the water and electrolyte balance. Okay. For example, the thirst is increased. It stimulates the thirst center. Situation is water deficit that leads to increased thirst. First point, which leads to increase the plasma osmolality. Right? These 2 points simultaneously happen. The water deficit means they will go for increased plasma osmolality. That leads to stimulation of hypothalamus. Okay, osmoreceptors in the hypothalamus. That leads to send the signals to posterior pituitary, which secretes ADH, antidiuretic hormone. The name itself, antidiuretic hormone, or otherwise vasopressin. Then they will stimulate the kidney to increase the reabsorption of water. Okay. Finally, excretion of small volume. Right, we have to retain the water, that is why excretion of small volume of concentrated urine. Okay, this is one situation. Here the water intake will be more because of the thirst is more, right? Another scenario, we have decreased thirst, that means water excess. That time the plasma osmolality is also decreased. That leads to inhibition of the hypothalamus. There is no need of stimulus. Then secretion of ADH is also decreased. That leads to decreased reabsorption of water by kidney. Right? Finally, excretion of large volume of diluted urine. Here, small volume of concentrated urine. Here, large volume of diluted urine. These two mechanisms finally maintains the plasma osmolality and water balance. Right? So, hypothalamic regulation as well as role of ADH in regulation of fluid and electrolyte balance. Right? You have to write two separate mechanisms. Finally, you have to mention the balance or restoration of plasma osmolality as well as water balance. Okay? Hi students, உங்களுடைய second question, role of vasopressin, right? Vasopressin is otherwise called as antidiuretic hormone ADH. Okay. Today we are going to see about the role of antidiuretic hormone in water and electrolyte regulation. Okay. Very important small short notes. So the name is vasopressin or antidiuretic hormone. Okay. The first and foremost point for this vasopressin is plasma osmolality, right? So osmolality is the number of solute particles per unit of weight of the water. This is one line definition. Solute particles per unit weight of the water, actually kilogram, right? Second one is this osmolality, the major determinant factor is, that is electrolyte is sodium. If the sodium affect means water affect. Water affect means sodium will get affected. Like that they will be balanced. That is a sodium and water balance or electrolyte or water balance. Electrolyte means mainly sodium. Okay. So sodium is the major determinant of deciding the osmolality. Already in the previous video I have given the formula, how the formula derived and what is the normal level. Here also I want to tell the normal level, that is 285 to 295 milliosmoles per kilogram. This number is also specific and special, unit also very special. 285 to 295 milliosmoles per kilogram is the normal osmolality. This osmolality affects the movement of water across the cell membrane. That is why we have to maintain the normal sodium as well as water balance, right? Your question is role of vasopressin or antidiuretic hormone. First point is you have to define what is osmolality. Second point is formula with normal level. Third point is how it affects the osmolality, right? So next one is one small mechanism. We have two conditions. Already we discussed in the hypothalamic mechanism also. Here they are asking specifically vasopressin. That is why I am giving separate discussion, separate answer. So increased thirst. Scenario is increased thirst, that is due to the deficiency of water intake. That time the plasma osmolality will go up, increased. So the increased osmolality stimulates the posterior pituitary and releases ADH, that is antidiuretic hormone or vasopressin. So the role of vasopressin here is that increases water reabsorption in the kidney by renal tubules. That leads to balance of sodium and water, and finally they maintain the plasma osmolality. This fourth point is very important, very easy also. Increased thirst leads to increased plasma osmolality. That stimulates the posterior pituitary, releases ADH hormone. This ADH increases the water reabsorption by the kidneys. So finally the water and sodium maintenance will be there, leads to plasma osmolality maintenance. Okay. The next same fifth condition is this is opposite. Here increased thirst, here decreased thirst. Here plasma osmolality increase, here plasma osmolality decrease. That also leads to posterior pituitary stimulation to decreases the ADH secretion and maintains the sodium and water electrolyte balance. Sodium and water balance. Right? So finally the last point is general functions of vasopressin is it maintains the blood volume, it maintains the plasma osmolality, it maintains the regulation of blood pressure. Three functions: blood pressure, plasma osmolality and blood volume. Okay. Yes, your third and fourth question is electrolytes related, right? We know the electrolytes are sodium, potassium, chloride, right? They are asking only sodium and potassium, right? So sodium, what is your question? Normal level of sodium, hyponatremia, hypernatremia causes. Potassium also the same. So we are going to see just 3 points for your test question. Okay. First one is sodium, the normal value is 135 to 150 milli equivalents per liter. Unit is very important. If you are not mentioned the unit means they will be definitely reducing your marks. 135 to 150 milli equivalents per liter is the normal value of sodium. Hyponatremia, that is the level will be decreased. Hypernatremia level is high, right? So hyponatremia, when you will get the diseases or conditions for hyponatremia, right? VD means vomiting and diarrhea. Vomiting, diarrhea. Because of the expulsion of the content of the GIT, they will go for hyponatremia. Sodium electrolytes will be lost in the gastric secretion through vomiting and diarrhea, right? Second one is important adrenal disease. That is insufficiency of adrenocorticoid produces Addison's disease. These patients also having hyponatremia. Sodium will be less. Next one is burns condition. All the fluid will get lost. No. So the burns patient always go for hyponatremia. These are all the causes. Hypernatremia. When the sodium level will be raised. What are all the conditions for hypernatremia? Physiological condition. Pregnancy. Usually the pregnant mother will get high level of sodium. Second one is dehydration also. They will go for hypernatremia. Third one is here adrenocortical insufficiency. Here hyperactivity of the adrenal disease is Cushing's disease. Cushing's disease produces hypernatremia. The last one is steroid therapy. One of the important drug for hypernatremia is steroid drug, that to prolonged treatment of steroids will produce hypernatremia. So you have to mention 2-3 causes for hyponatremia, 2-3 causes for hypernatremia. Okay. The next question is regarding potassium. The ICEC means extracellular and intracellular. Sometimes in MCQ they will be asking intracellular is potassium major cation, extracellular major cation is sodium. The normal level is 3.5 to 5.0. Very simple. This is 135 to 150. You remove the 1, put 1 dot in between these two. 3.5 to 5.0 milli equivalents per liter. Unit is same only for sodium and potassium. We have two conditions, hypokalemia and hyperkalemia. Here also V means vomiting, D means diarrhea for hypokalemia. Then metabolic alkalosis. This is very important cause for hypokalemia. In metabolic alkalosis, metabolic alkalosis means hypokalemia. Whereas metabolic acidosis means hyperkalemia. Okay. And then diuretics. Here steroid for sodium, potassium drug name is diuretics. Patient is taking diuretics means all the potassium will go by excreted by urine. That is why diuretics produces hypokalemia. Here the first condition is renal failure. That is for hyperkalemia. Renal failure and metabolic acidosis. There are so many causes. These two is enough for your test university questions. Okay. So hyperkalemia only two causes, renal failure and metabolic acidosis.